People will ask what I recommend for a chiropractic adjusting table, and this is such an important decision because you plus your table plus your technique is what's going to bring the results, and it's what's going to change thousands of lives. So I take my adjusting table seriously, so seriously, I've made a bunch of modifications to a table and now they name it after me. And so this is called the Zenith TR1 table, okay? Once again, you are calibrated to your table. My pressure is calibrated to how soft the foam is, the height of the table, all of this works together, okay? As you apply technique with your patients. So let's take a look here at some of the different features that make this table very, very unique. Now what this was, it started as a high-low table, a tippy table as it's sometimes called, okay? Indy, Dad's making a video. Will you let Dad make a video here about, are you giving kisses? Okay, all right, that's enough. All right, Indy, get lost. He's not helping us very much, is he? This is Indy, the world famous Doberman. He is the official Winner's Edge dog, okay? And he's hanging out with us here this morning, as he normally does in the office as the guard dog. But he wants attention right now. Indy, I have to make this video, okay? So that means you can't be here. Apologize for that little distraction there. But he thinks when I get down to his level that it's time to play, and I can't blame him for that. So these start as a high-low table. Now, we never recommend the high-low table for like the most obvious reasons that don't even need to be explained, but I'm going to explain them anyway. One, it's dangerous, okay? Because kids get underneath it, they push the button, that's sort of a problem. If you have a person prone and they're relaxed and they go up and then they have their body weight on their spine now, that can be a problem. And of course, it's about 8 seconds down and 8 seconds up. Multiply that by even just 40 patients a day. Calculate the number of minutes that is in a year times $50 a minute. And then tell me if you think you want one of those tables. It's kind of a cool thing. Some people use it out of nostalgia, okay? But it's, no, don't ever do that. And if you have them converted into this and you'll be 100 times happier. Anyway, so here we have this Zenith that's had the bottom removed and had the foundation modified. So here's what this table has that's unique. It has thicker foam, like 3 3/4 inch foam. It's thicker foam. It has the upgraded, more leather feeling material versus a vinyl-y sort of material. You notice it has the wide pelvic piece, okay? And of course you see the thicker foam here too. And of course this has the flexing thoracic piece. This may be the single greatest invention ever in chiropractic table history, is this right here. And I will tell you right now, there is no adjusting anything, okay, from T8 down into the lumbars with any effectiveness without this. And the key to it is it's separate from this piece. See how they move separately? Sometimes you have tables that just have one piece like this. No good. They're just no good. And if you put people on one of those, on one of these, you'll see the difference. Things will move easy here. You have to give a place for the vertebra to go. See, if I have a rigid table and I push with 10 pounds, well, the table opposes with 10 pounds, you just, the person. You have to give the vertebra a place to go. Just like cervicals, okay? You have to give the vertebra a place to go. So it has to flex. And this tension is critical. And we have how we set that, and that's a topic for another day. Now, next thing is this. This little square piece, which is one of the greatest inventions of all time, is super, super soft foam. It's a completely different foam from the rest, okay? Why? Because we've got to be able to adjust upper thoracics. And if you have a regular table, it is hopeless, okay, compared to this. See? Super comfortable for men, women, okay? Super comfortable, all right? So that piece, separate from this piece and the flexing, all right, are what allow us to lay a person prone and do basically everything, okay? Now, we have it set up so all the mechanism is shoved toward the head of the table as far as possible to accommodate taller people. And then we have the appropriate tension and everything that's set up for all the different things. Now this, also on the TR1, we have a pelvic drop, which may be super handy for people that'll be more difficult for you to adjust. Okay? Pelvic drop, we don't see any need for any drop anywhere else in the spine. In fact, if you have a table like this, never would you ever need a drop for the thoracic, because if you use the same force with this table, things will move more and you don't need the clunking mechanism of the drop. I know some techniques hang around drop. Well, mine doesn't, okay? So if you are serious about laying people prone and you want to be able to adjust all through the thoracics, get into the lumbars, be able to do drop on the lumbars here, okay? Then this is the ideal table. Now, I don't do side posture here. I have a bench for that because that is the ultimate tool for side posture adjusting. The regular Gonstead bench, it's just one of the most valuable pieces of equipment ever. I've got 2 of them in my office here right now. Then, of course, if I need to, I will go to the chair for seated cervical adjusting. But for everything prone, it happens here. I have never, not one single time, laid a patient on their back ever in my chiropractic career. 30 whatever years, like 800,000 or 1 million adjustments. Everything is prone here, and if I need to do anything beyond this, they go to the chair or they go to the bench, and I'm still able to have my office visit time, my treatment time, be under 90 seconds, 48 seconds, 72 seconds, in that range, and that's fine for me. So the TR1 table, it's something that people say, hey, we don't sell tables, we don't make tables. There's a manufacturer we have around here that takes the table and makes these modifications for our people around the country. So take your adjusting table seriously. Okay, it is the key piece of equipment, literally, that you need to apply your technique and get the best results possible.